Live from the Washington, D.C. area, it's the Inside Scoop, Emerald Planet. All the ecology news that our viewers want to know. Now, here's your host, Executive Director of the Emerald Planet, Dr. Sam Lee Hancock.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look around the globe in 144 different nations, looking at the 1,000 best practices, the technologies, the services, and the products that are making a difference as we move through the 21st century. As we add 2 billion new people, yes, 2 billion new people to the planet by 2050, how are we going to go about actually giving them an increased quality of life, not just a subsistence existence on the planet? And so we need to look at everything: energy, water, food, also the basic infrastructure of healthcare, education, telecommunications, all the other things that they need. We have someone that's going to join us and talk about the country of Mali in West Africa. He's going to be talking about some of the changes that are happening in this landlocked country in the western part of the continent. And her name is Jessica Beckerman, who is the co-executive director of what's called Project Muso. Now this is in Mali in West Africa. And right beside me is Nelly Pavisich, who is International Service Committee co-chair of Rotary International of Washington, D.C. And she's in the studio, and Jessica's coming to us by Skype. Jessica, welcome to the Emerald Planet.
Thank you, Dr. Sam. It's really a pleasure to be here today.
Well, you're doing absolutely fantastic in the country of Mali, and I know that there's been some trying times over the last couple of years, but Project Muso is hung in there and doing very wonderful things for the people of Mali. But tell us, what is Project Muso?
Well, thank you so much. So Muso is a nonprofit organization that is now 8 years old, and we've been really very honored to partner with Nelly and the Rotary Foundation, in addition to some of our other partners, to ensure that kids are not dying of preventable and treatable diseases.
Well, I tell you, that's a tall order, because I know that there's a high level of infant mortality in that country. Tell us a little bit about, why that's the case, and particularly in a country like Mali. And then we'll talk about what Project Muso is actually doing about it. But what is the challenge, and why are the infant deaths so high?
Sure. So Mali really is at the epicenter of the global crisis of preventable child death. About 1 in 5 children die before their 5th birthday in Mali. And the cause of this is multifactorial. The level of poverty in the country is also one of the highest in the world. And poverty leads to a high burden of disease, as well as a lack of healthcare access. And that really has made for a deadly combination.
Well, looking at that, what was actually the path that you went through to actually create the Project Muso, and what does Muso, the term itself, actually mean?
So I found myself working in Mali with a small group of Malian and American doctors and researchers in 2005, and we found ourselves living and working together in some of the poorest communities in the world. We found ourselves regularly attending funerals for young children and for women, and we wanted to create a different kind of world for our children and our grandchildren to live in. And so since then, we have partnered with the Ministry of Health and with local women who are struggling to keep their families alive to create Muso. So Muso means empowered woman. And the reason why that has been so core to our model is because we really start with local women, local mothers, partner with them to tackle this enormous crisis and ensure that they have the skills and the resources to take the future of their children's survival and well-being into their own hands. And we found that really they are uniquely qualified to make an impact both locally and also globally.
Looking at the conditions in that country, what is the percentage of women? As you know, in many developed countries, the number of females in the society actually now is outstripping the number of males. Do you have a similar condition in Mali? And if so, what is the impact on not only the families but also the communities within the country of Mali?
Sure. So the prevalence of women and men in Mali is similar. I think it's only a very small percentage higher of women, which is similar in most parts of the world. Although women have higher health burdens or a higher burden of disease. 1 in 22 women die from pregnancy or childbirth-related complications, which is one of the highest rates in the world. And so in addition to partnering with women to ensure the health and well-being of their children, we're also partnering with women to ensure their own health and well-being. And all of that works synergistically together, because women who are healthy and have access to care during pregnancy and childbirth also have healthier infants. And as you mentioned, Sam, the rates of infant mortality, the rates of death in the first year of life are even higher than the rates within the first 5 years.
Oh, I tell you, that's an incredible statistic that you're sharing with us about what's going on in the country of Mali in West Africa. But what's the impact of poverty on these people, whether in urban areas or rural areas? There's similar conditions that the females, as in the households and their children, seem to be spread throughout the entire country and maybe across all of West Africa itself.
Absolutely. Well, poverty means that, at a national level, healthcare centers are understaffed, they're under-equipped, providers don't have access to the training that they need to provide the highest quality of care. And then communities have limited access to health centers due to geographic accessibility and poor transportation. In addition to that, the lack of access to information about illness and preventing disease and education overall makes people at higher risk for contracting illness. Only about 11% of Malian women are literate, and so the gender inequities are also palpable. And finally, unemployment is the most direct link between poverty and health, and inadequate access to income to pay for healthcare, particularly in a country where all healthcare is fee-for-service outside of a couple of isolated programs such as Muso's, means that if you don't have employment, which is hard to come by, then you can't go and see the doctor or get access to medication when you're sick. And then finally, if you don't have access to income, then basic health needs like vegetables or soap to keep communities healthy and out of the hospital are also a challenge.
Well, Jessica, it's similar to the conditions you have at at-risk communities, even in the developed world, as far as a direct correlation between education and employment and the impact within the family structure itself. So thank you for sharing those parallels. And as you know, our mutual friend Nelly is sitting right beside me, and she's here in case we lose you by Skype, and she's going to ask the next question. Nelly?
Yeah, why don't you mention some of your 2 or 3 best practices that created Project Muso, which can actually be replicated around Mali and across the African continent, Jessica?
Thank you, Maria Nelly. I think that's an excellent question. So we have found that what we're doing is working, and we're committed to making it grow and committed to sharing what we're learning, both about what works and what doesn't work with the rest of the world, because this issue of child mortality is not limited just to Mali, but we see more than 6 million kids die unnecessarily around the world. And so it certainly is a global problem. So I think 2 of the things that we have learned at Muso that are valuable lessons are, one, the power of local women, local mothers, who, in professionalizing their skills, employing them, training them, paying them for their incredibly productive labor, and supporting them to grow in their jobs, keep them in their communities, is something that is a global asset. We have mothers everywhere, and so taking advantage of the skills and the talents that they have to take care of their own children and to become experts at health and disease prevention for their neighbors' children is invaluable, and something that we are learning better and better about how to do well. And then I think the second thing that we've learned at Muso that we're proud to share with others is the importance of the synergies between an accessible healthcare system that is a healthcare system that reaches out into communities through local women actively, and the importance of mobilizing communities themselves to build rapid referral systems and connect into the healthcare system as well. So the positive synergies between an accessible, high-quality healthcare system on one hand, and then a mobilized, educated, informed population on the other hand that can link in together really creates a model that's more than the sum of its parts.
Well, looking at and those are very complex notions and ideas, but I know that you're having a direct impact through very practical things like the distribution of mosquito netting and soap and other kinds of things. Tell us a little bit about some of the very practical best practices that you've been introducing in the communities around Mali that others that are watching us actually from the continent of Africa and even South America, Southeast Asia can identify with and actually could use, within their own communities.
Sure. Well, I think BedNets is a great example of something that we're really proud of being able to partner with Rotary on. We've been able to distribute nearly 20,000 mosquito nets, impregnated mosquito nets, to protect families from mosquitoes at night, which transmit malaria. In addition to that, we're reaching individuals in their homes every month. Just last month, we reached almost 19,000 households in 1 month by these local community health workers who are looking proactively for cases of illness and providing health care in the home, as well as bringing sick patients into the health center for more advanced care. So really making sure that healthcare is accessible has been a number one priority for us. And over the past 2 years, we've also made great strides in reaching children quickly, because the number one cause, or the number 1, 2, and 3 causes of child death kill kids quickly. We really need to get to them within the first 48 hours of their symptom onset. And so we've been tracking those indicators. And over the last 2 years, we've reached 92% of children within 72 hours of their very first symptom. Something that we are hearing from the population has resulted in less illness and less death. The imams and the doctors in the communities where we're working tell us that they see fewer children dying. The imams say that they're no longer officiating for burials for children in a way that they once were.
Well, we're going to be losing you in about 2 seconds. And so Jessica Beckerman, who is the co-executive director of Project Muso, Mali, West Africa, thank you for being with us and sharing about what is going on in this country in West Africa. And I have sitting right beside me Nelly, Pavisich, who is the International Service Committee co-chair of the Rotary Club of Washington, D.C. And thank you for being with us as we look around the globe to discover how to create the Emerald Planet.
Around the world, 1 out of every 3 women will be beaten or otherwise abused in their lifetime, often by a family member or loved one. A future free from violence. It's all she's ever wished for.
Did you know you have the power to stop children from joining gangs? You can help a father find a job and home for his family. You can assist a woman who can't afford the medicine she needs to live and the home she can't live without. You can choose to make a difference in our community. Support Volunteers of America, and you can help improve the lives of nearly 2 million Americans each year with programs and services that help individuals and families overcome their challenges to become as independent as possible. Support the programs that are working in our community. Contact Volunteers of America today. Call 1-800-899-0089.
For some folks, saving for the future is easy, but for you, it might take a little more effort. Saving for your future is your responsibility, and there's a lot to save for.
I never thought of that.
Like your child's education, perhaps uncovered medical expenses, or just to be sure you can live the way you want when you retire. The time is now to save for tomorrow. Save now or work forever. The choice is yours. Choose to save.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we look around the globe in 144 different nations, seeking those 1,000 best practices, the technologies, the services, and the products that will be needed as we move towards 2050. By 2050, we'll be adding about 2 billion new people to the planet on top of the 7 billion already here. Many people are saying there's no way we can take care of that many, and the short answer is we need to figure out a way to do that. And so the Emerald Planet, which you're watching right now, is looking around the globe in these different nations to identify the best practices that can actually increase the quality of life and expand the opportunities and services for people that are going to be adding to that population base, regardless of the country. We have a gentleman who's been actively working in the country of Mali, which is on the western area of the continent of Africa, for a number of years, establishing Rotary clubs and also working in local communities, not only in his own home country of Mali, but throughout West Africa. We have Sonny Akuopha, who is the Stewardship Chair of Rotary International District 9101 in West Africa. And this is a major foundation has been established there. And right beside me in the studio, in case we lose Sonny from Mali, is Nelly Pavisich, who is the International Service Committee Co-Chair, long title there, Nelly, of the Rotary Club of Washington, D.C. So, Sonny, welcome all the way from Mali and West Africa.
Oh, thank you.
Glad to have you here. Tell us a little bit about the Rotary International District 9101, the foundation, and also just where you're located. We have your map, and we'll put that up. And tell us a little bit about Mali and where you are and the foundation, and then we'll start talking about the country itself.
Yes, we are in Northwest Africa. Mali is in Northwest Africa, and the Rotary District 9101.
Yep.
9101 is made up of 10 countries of West Africa.
Well, I tell you, that's a large territory. How are you able to get around to all those different countries, or do you operate everything from within Bamako, the capital of the country of Mali?
Yes, sometimes we need to travel to these countries by road or by air in whatever manner that is available to us to link up with other countries in the district. With language difficulties, we speak French and Portuguese and English.
I see. Well, looking at what you're doing, I know that you've been involved in Rotary for a number of years. Why did you become so involved in Rotary in your country when that's directly linked to the United States and countries around the globe?
Yeah, you see, I've been a Rotaractor since 1985, and I've been trained to become a Rotarian. And the Rotary, as you know, is about service above self. It's about the little you can give from your intelligence, from your time, and from the little money you have, to help other people and make smiles in any community, whether it's local, international, or national.
Well, it's absolutely fantastic. Sonny, if you'll just sit up a little more so we can see your happy smiling, there you go, your happy smiling face.
Thank you.
What motivates the Rotarians in the country of Mali that's trying to move towards being an emerging market nation and also bring services around the whole country to benefit the people of your country?
Yeah, it's also about the serious human needs. We have a lot of humanitarian problem here in Mali, as you know, and those of us that are being fortunate to go to school, fortunate to have good work, can't turn our eyes away when we see a lot of suffering around us. That is why we take a little bit of our time and our money and intelligence to link up to other Rotarians in the world to see that we're able to do good things.
Well, when you say a little bit, I know that's an understatement. You're being very modest. Nelly and many others talk about the fantastic work you're doing in your country, and of course there are many needs there, as they are in other countries across the African continent and around the globe. But how do Malians actually access both health care and education within your country?
At the moment, we have community health centers they call CSCOMs, and we also have community schools in 3 different categories that people can access. Although they have problems of facility and staff, so they do not function very well. But at least we can make do with them at the moment. Well, at least you're working very hard to do that, and I know that you've been able to partner with many Rotary clubs around the globe, not only in the United States, but many countries in Europe and in Asia. But as you know, our mutual friend Nelly is sitting right beside me, and she's here in case we lose you by Skype. And so we're going to let Nelly ask you the next question. Yeah.
Sure, Sam. Sunny, I'd like you to ask you to expand on the special challenges that Mali face and how Rotary International supports, particularly to provide maternal and infant health care in such a large country like Mali.
It's been very difficult, but like you see, the statistics we have, show there's not been a real improvement. All aid we've got for the past times have been very, very insignificant. That is why we really thank this partnership with the Club of Capitol Hill in Washington in seeing that we're able to do more. Because far back in 2008, the infant maternal mortality rate was 108 children to 1,000 at delivery. But now the rate has increased slightly to 109.49. You see, these are statistics of loss of life. It's not ordinary statistics, and it's very, very worrisome.
Well, looking at the photograph we have here, I know that not only do you collaborate around the globe with many different countries, but also you work very hard to collaborate within Mali itself. What are some of the challenges, and then maybe how you've been able to overcome those challenges to communicate among the major cities and towns of Mali, and then to also include the very rural areas of Mali?
Yeah, but that is why we started establishing a new Rotary clubs in Mali, because through the Rotary clubs in every locality, we're able to reach out easily. And the first project we had in 2010 with the Capitol Hill Club was in one council. And in Mali, we have 701 councils. We were talking about just one council that has been helped so far. So it's been difficult, and through the spread of Rotary clubs, we think we're able to do more. And through people like Nelly and the club in Washington, we think we can do more.
Well, looking at I know you've been very involved with the Project Muso, which is bringing the balance of education and also health care to the people. But what are some of the outreach you've actually done with the Malian public schools in your country that you feel like you're being able to reach not only the children in these schools, but also the parents as well?
Yeah, through a project we had with the WC in Boston, we were able to get 500 computers from the WC that is based in Boston to help with ICT programs in Malian schools. And now we're talking about visual libraries in Yamakoro, also in Bamako. So through modern libraries and computers, we're able to give more education to students in Mali.
Now, looking at your collaboration with the government schools, I know you say we're talking about the funding levels and the challenges you have with the schools, but what is the long-term impact do you see, Sonny, for collaborating with the government schools? And also understand you're probably collaborating with some of the private schools within Mali.
Yeah, it's promising. It's promising as long as it's consistent. Once the help and aid is consistent, then it's going to have a lasting and a long effect on the people and the children. We're going to produce better professional students. We're going to produce our own medical doctors. We're going to produce our own engineers, within a very short time. That is only when the collaboration is consistent. But if there's a break in the cooperation, then there's going to be a very big danger to the whole process.
Well, I know one of the big projects, of course, we're talking about the mosquito netting, but also to address the issue of malaria, which has a devastating impact on the children and even the oldsters within your society. So how do you see this collaboration with the United States and many other countries around the globe through Rotary International helps you to address this one very specific area, this specific problem, the notion of malaria and its negative impact on society?
Well, I think the help from Washington has been a very good one, because now we're talking about a 400% increase from what we had in 2010. So, and if we, after this, maybe we may go to other scale, maybe 1,000% of the present help. With gradually 2-3 years, we may have a total impact on the whole country of Mali.
Well, I know one of the real challenges you have, of course, is quality water and malaria, dengue fever, yellow fever. All these various tropical diseases really has a negative impact on society. What is the Rotary Club doing, or any projects you're thinking about to address this issue as far as water is concerned?
Yes, at the moment we have about seven water projects that we are studying, and before October we shall get new water projects for new localities. There's the club in Pasadena, Maryland, that is interested in helping in Mali, and there's a club in Washington, Seattle, that is also doing some work in Mali. So through World Vision and the Rotary collaboration, I think we shall be able to do more water projects in Mali this year.
Well, I know we're talking about Future Vision, which is the new effort by Rotary International to reach out to countries around the globe, to reach in to help people. We have about 30 seconds. What do you see for the growth of Rotary International and the work that you're doing, say, over the next 5, 10, 15 years as we move to 2050? And we have to be quick.
Very, very promising, and we expect to have a Mali district by the year 2050.
Well, I tell you, that's a short answer.
Yeah, thank you.
Sonny, we certainly appreciate you being up this late and talking with us from Bamako, the capital of the country of Mali. And
thank you very much. It's my pleasure.
It's wonderful the work that you're doing there. So this is Sonny Akuopha, who is the Stewardship Chair of Rotary International, District 9101. in West Africa, and he's representing the foundation there. And we have Nelly, Pavisich, who is the International Service Committee co-chair of Rotary Club of Washington, D.C., as we create the Emerald Planet.
Saving for retirement might be easy for some folk, but for others, it might take a little more work. And for those who haven't started, there are still things you can do to catch up.
Oh, that is good news.
Like getting out from underneath past debt. And don't get wrapped up with high-interest credit cards.
Get you some eyes.
Be diversified with your investments. Don't put all your eggs in one basket. Your financial goals are not out of reach. The choice is clear. For a happy ending, choose to save.
Everyone with alcohol and drug addiction is in the same boat. With treatment, you can find solid ground. For drug and alcohol information and treatment referral for you or someone you know, call 1-800-662-HELP.
Dude, are you sure you want this tattoo? Because just do it.
Some mistakes in life are permanent. Like hearing loss. To learn how to protect your hearing, visit asha.org.
You've probably heard about heart disease, but did you know that it's the #1 killer of women nationwide? Heart disease claims more lives each year than breast cancer, lung cancer, or strokes combined. But there are steps you can take to protect yourself against it. For more information on how you can prevent heart disease, contact your local American Heart Association or visit their website at www.americanheart.org.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello, and welcome back to the Emerald Planet as we come to you from Washington, D.C. and the United States as we look around the globe in 144 different nations looking for the very best practices, actually the best of the best, that are going to make a difference as we move through the 21st century towards 2050. By that time, that seems to be almost the drop dead date as far as where is the climate change going to be impacting on the climate, and also as what kind of resources we're going to have to marshal to take care of 2 billion people, yes, 2 billion new people on the planet, and that's on top of the 7 billion that we already have here. Also at the same time, the world is rapidly urbanizing, so we're going to go from about 54% people living in urban areas to over 80%. And as many of you know, a country like Brazil, which is a middle-income nation now, is at 87% urbanized. And so what is the impact is that going to have as far as access to food, water, energy, and also the basic infrastructure of healthcare, education, and all the other needs that these 2 billion new people will have. We have someone who's been working on this through Rotary International for a number of years. Sitting right beside me in the studio is Nelly Pavisich, who is the International Service Committee co-chair of Rotary Club of Washington, D.C. And I must admit, Nelly, this is a very short title for you because you've been doing a lot of things. And also you've been very actively involved in the Future Visions projects with Rotary International. So let's start off first. What is Rotary International? And then what is Future Visions?
Okay, thank you, Sam, for having us here today. Well, Rotary International is a large non-profit organization that basically associates professionals like you and I doing service for the community, not only locally but worldwide. Basically, we meet and we discuss topics, and some of us engage in international service.
Yeah, and looking at it too, as far as the future visions, I know this is really a new dynamic, a new way that Rotary clubs are organizing themselves. Some 34,000 clubs around the globe and over almost 190 countries now. So how does Future Visions work, and how is that different than maybe, say, 5 or 10 years ago when Rotary clubs were involving themselves both within their local communities and internationally?
Well, this is the exciting times of Rotary, an organization that has been around for over 100 years. Well, we used to do small projects in communities, and we had issues with impact. We could not sustain keep doing these small projects. So when we realized that we are an organization that is basically in every country of the world, we started to scale up our efforts, and Rotary International basically had a pilot process called Future Vision, which ended last year, actually. In this Future Vision effort, only 100 districts out of, 900 were involved. Nowadays, every single club in the world can actually partner to do something. So nowadays, we are looking at big picture, big projects, and so we can have more impact in the world.
I think this is something you and I both have been advocating for a number of years, that we really need to have sustainability built into our projects and have larger scale so you're having more impact. And also, these are best practices that we're developing. But you're a professional educator and leader. You work with the Inter-American Development Bank, and yet you're giving so much time, and you travel, and you're doing so much great work around the globe. How do you balance all these professional duties that you're doing and being involved with Rotary?
Yeah, a lot of people say that Rotary has been the longest career I had so far, 23 years doing this. And it's just, you have it in the blood. I grew up in a developing country like Bolivia, where you have the needy, just you open your door and the need is there. So I have Rotarian parents, a Rotarian family, and it just feels good, basically, to do whatever you can with your sort of spare time, if we can call, over weekends and nights, to connect with Rotarians and do something to make this world better.
Well, we have the slide up, and this is the End Polio Now. And of course, the Bill and Melinda Gates Foundation has been collaborating with Rotary International to actually eliminate the scourge of polio around the globe. Getting closer, almost there. But what are some of the other projects that Rotary International works with, and particularly in, say, child mortality and public health services for females in all countries around the globe?
Yes, End Polio is actually one of our, like we say, flagship projects, programs in the world. And we also have action groups of Rotarians, professional Rotarians, working against malaria. There's action, we just recently did, in our case, a project in Mali, and help with Project Muso and Rotarians in Mali distribute these bed nets and treat over 3,000 people. And just as other examples, in HIV/AIDS, also in East Africa, our club has a project in Kenya to support Nyumbani, who treats HIV-positive orphans. Just to name some, there are many more, of course.
Well, I know that Rotary International is tied in very closely to the United Nations and the Millennium Development Goals, the MDGs, as they're called. What are some of the Millennium Development Goals that Rotary is collaborating with? And then, of course, Rotary collaborates with thousands of organizations and also businesses around the globe to address many of these goals that are out there.
That's right. We actually picked 6 of them, and one of them is water and sanitation. And we have disease prevention and control, disease prevention and treatment, child and maternal health. We have peace and conflict resolutions, and also economic development.
Yeah, I think this has really been an interesting development, because in the past, this is before the Future Visions, we were very much focused on local projects, whether it was domestically or international, but now including in that peace and trying to quell the open revolts and wars and things that are going around. That's a very ambitious project for a nonprofit organization to be taking on.
That's right. Actually, at this point, we are also even scaling up a little more. We have a project coming up called Thrive for 5, and as we heard before, our other guest speakers mentioned the problem of child mortality in Mali, and we might want to make a difference. And we have the goal to basically reduce by 50% the child mortality rate in the community of Yirimayo, Mali. And we know we can do it. There's solutions to this. There's a model that you'll hear about later on that can help us do that. That's very exciting. When you see these numbers, the child mortality numbers, and you actually pick a community and see if you can make a difference there, that really makes us feel good that we can do it, actually.
Well, looking at these photographs, I know these are actually some of the people that you and many other people have been working with. And this Thrive for 5, I think it's really a great initiative that you have. And so when you look at these young ladies and also these children, what are they seeing through their eyes on a day-to-day basis, and how is Rotary and how is this Thrive for 5 actually changing what they physically see around them?
Yeah, actually, what is interesting, they don't see us Rotarians here in Washington. They just see what Rotarians in Bamako are doing for them, and also this organization and the community health workers that make this possible. Actually, when you have a kid sick in your home and you don't have no money to take them to the healthcare, or you don't even know what they have, if you have the luck to have a community health workers that will come to you and nobody knows that she has anything to do with Rotary, then that child can actually be treated and and saved. So we are behind the scenes, I would say, Sam. We don't do a lot more than write proposals and get the funds, and then the people on the ground do the work, including volunteers that come from all over the place to help them.
Well, I know the volunteers are critical in all that, and of course Rotary is, the almost 1.4 million members are all volunteers, and it's interesting about Rotary International, you actually pay to be a volunteer.
Yeah.
And get involved. That's a very unique concept that we have. But what other organizations is Rotary International partnering with, and even the Rotary Club of Washington, D.C. in this Thrive for Five?
Well, in this one, basically a number of Rotary clubs around the world. We are very excited to see the Rotary Club of Harrow in UK, and you have a Rotary Club of Hamilton in Canada. You have one in Germany, and you also have one in Hong Kong, in China. In the past, we had somebody from India also to partner. And we have several local clubs that work together. We want to reach at least 10 clubs and at least 10 districts in maybe 8 countries. Isn't that amazing?
Oh, that is absolutely amazing. And think about all the different cultures, the language, even the food that's involved and all that, and yet everybody's coming together for one common goal and one common cause. Going back to Bill and Melinda Gates, there's a number, they're very strong collaborators with Rotary International, and also there are a number of other large foundations involved. So what do you see as far as going on globally that you see is actually going to expand the reach of Rotary, but also the reach down into communities? So there's actually a difference. When you talk about saving 50% of the children in a short period of time, that is an incredible impact in these local communities.
That's right. And actually, in partnership, regarding the partnership part, now that Rotarians are learning to do larger projects and basically combining not only our funds and our efforts, but also our expertise, it would be interesting definitely to connect with the Bill Gates Foundation for the malaria prevention in this area of the world. What we do not know yet is how to do it. Bill Gates and Melinda Gates Foundation, they basically do large-scale projects. They do a lot of research. So we are very curious to know if they can support smaller projects, or at least observe it so it can be replicated. In terms of other organizations, we in the past partnered with other malaria-related organizations that help us, for example, leverage our resources for bed nets. And so we keep looking. We need the more partners we have, the better impact we make.
Well, looking at yourself and your background, you talked about your long history, and many members of your family have been Rotarians going back a number of years. But being from the country of Bolivia, what did you learn as a child that actually has helped you as we move forward towards 2050 and these Rotary projects and the outreach you're doing through the IADB? And we only have about 30 seconds. So
I know. I learned to be grateful for what I have and share what I have that I don't need to keep for myself. For example, my time. And basically Rotarians do that all over the world. They give their time like you do, and several of us do also, and just to contribute a little bit. It's gratitude.
Well, I know when we look at these faces and the challenges that we have globally, it's a huge task that we have. But with the 1.4 million Rotarians around the globe and 34,000 clubs, it's a huge impact that Rotary can have. And Nelly Pavisich, who is co-chair of the International Services Committee of the Rotary Club of Washington, D.C., you're doing great work. And thank you for being with us on the Emerald Planet. Thank you.
There's more than just books at the library.
There's more than just books at the library.
Excuse me. There's more than just books at the library.
Il y a plus que de livres à la bibliothèque.
Hello. You have a lot of great books here today. There's more than just books at the library.
I know.
There's more than than just books at the library.
I don't want to be hooked to a machine.
I want all the medical treatment available to me.
I wouldn't want my family to have to make this decision.
My doctor knows what's best for me.
An advance directive is your life on your terms. Talk with your family. Decide what's right for you. Then put it in writing.
Documenting my wishes today means my family won't have to make heart-wrenching decisions later.
To learn more, visit www.putitinwriting.org.
1,200 American youth run away from their homes every day. The National Runaway Switchboard is here to help. 1-800-RUNAWAY. If you are a runaway, thinking about running away from home, or a parent or guardian concerned about issues facing your child, call us 24 hours a day. 1-800-RUNAWAY. In times of crisis, hope is just a phone call away. 1-800-RUNAWAY.
To the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello, I'm Dr. Sam Hancock, the President and Executive Director of Emerald Planet and also the Emerald Planet Television in Washington, D.C. of the United States. We come to you on a weekly basis, looking around the globe in 144 different nations, looking for the 1,000 best practices, the technologies, the services, and the products that are making a difference in the lives of millions, even billions, around the globe. And so we want to share with you the best of these best projects as we add 2 billion new people, and the planet is rapidly urbanizing as more and more people move from the rural areas into large towns and cities, to where we have over 80% of the world's population living in these urban areas. So how are we going to be able to take care of them as far as the basic infrastructure and also the needs of health, education, and entrepreneurship, ways of providing small to medium scale enterprises for these individuals. We have someone who is coming to us from San Francisco and California, Dr. Ari D. Johnson, who is the co-executive director of Project Muso in Mali, West Africa. And right beside me, in case we lose Ari by Skype, I have Maria Nelly Pavisich, who is the International Service Committee co-chair of Rotary Club of Washington, D.C. And Ari, welcome to the Emerald Planet.
Thank you so much, Sam.
And we have a photograph of you with one of your young charges over in Mali we're going to put up here in the next minute or two. Tell us what our audience is. I know you're in medicine by profession, a Harvard graduate. Tell us how your professional career actually led you all the way around the globe to Mali to get involved and expand not only your medical outreach, but also your skills and understanding of humankind, which is a very unique trait, Ari, and we like to thank you for your service to the world community.
Thank you, Sam. So, after I graduated from college, I was doing global health research. I was working with a few different institutions, including the International Health Institute and the Medical Research Council of South Africa, among them. And eventually I found myself in Mali, living in communities where I saw my neighbors struggling with accessing healthcare for themselves and for their children. I found myself attending the funerals of babies and small children every week, and accompanying patients as they struggle to access healthcare for themselves and for their families. That experience, accompanying patients directly, led me into my training in medicine and led me to collaborate with Project Muso's co-founders to start Muso's work.
Well, I tell you, it's really fantastic, and when we look at the photographs, we understand a little bit of the challenge that you have. And as I was traveling in 13 different nations on the African continent, I saw firsthand many of the communities that you're working with. But as co-executive director of Project Muso, what are some of your duties as being that executive director. And what some of the new projects and activities are you actually creating in Mali that may be considered as a best practice that could be shared across the African continent, but also around the globe?
Absolutely. So, as executive director, I get to, the favorite part of my job is watching other people be heroes. And I get to do that every day. We have an incredible team of heroes, mainly local mothers, Malian mothers, who are trained as community health workers, community organizers, community educators, who are leading the charge and who are claiming health for themselves, their families, and their children. So that's my favorite part of my work. They really see themselves as change makers, and they are change makers. They're transforming the health of their communities. The new initiatives, that's a great question. So for the past 8 years, we have been designing and then testing a system for saving children's lives. And now, after these 8 years of experience, we have been able to learn from our experience and from our research as to how to make this system for saving children's lives even more effective. So we're in the process of implementing some key improvements to reach more children with more services faster, so that we can become even more effective in saving lives in places like Mali.
Well, this is a very powerful photograph of this young boy standing up on this outcropping and looking over one of these very remote communities in the desert of Mali. So what is Muso's strategy for saving children's lives in that country? But also, I know this really goes to saving the lives and increasing the health condition of the mothers, which are, key to the cohesiveness not only of the family, but also these disparate communities around the whole country.
Absolutely. So, Muso, to understand our model, imagine you buy a new computer and you install your favorite applications, high-performing applications that you use every day. You press the power button, but nothing happens. It takes you a minute, and then you realize, I forgot to install an operating system. Without an operating system, it doesn't matter how great your applications are, nothing works. And as researchers, when we went to look at why are so many children dying in Mali and around the world, it wasn't for lack of tools. They're dying of preventable and treatable illnesses. So the tools already exist, but the operating system wasn't there. The challenge is delivery. How do we get those tools to the kids who need them, and how do we get them to those kids fast? So that's what we've been focusing on. Muso's model gets to children quickly with extraordinary speed through active case finding. That means training local mothers to knock on doors and proactively look for kids who are sick. That means training community organizers to mobilize community members to look for sick kids and bring them in to the health system proactively. That means removing other barriers that mothers may face to reaching healthcare for their children, including fees that they might not be able to afford. So removing healthcare fees and building new infrastructure to ensure that when they do need care at a clinic, there is a quality clinic available to them. And then finally, supporting mothers to address the root causes of what makes their kids sick, enabling them to access education and opportunities to feed their families.
Well, I think it's a powerful methodology that you've actually developed, and as you said, it's 8 years in the coming, and it really is reaching into the very heart of the nation of Mali, but also into the hearts and minds of all these people. And if you can address the issues that the women are facing within these local communities, you're directly impacting every aspect of not only the community, but within their own homes, which is a profound change. As you know, our mutual friend and Rotarian sitting right beside me, Nelly, who you know very well. And so we're going to let her ask the next question.
Oh, Ari, I'd just like you to expand on why does easy and early access make such a big impact in saving a kid's life in Mali?
That's a great question. Thank you, Maria and Nelly. So the key to understand here is that most diseases that are killing children in Mali and in poor communities around the world are curable and preventable, but they are also rapidly progressive. Hours count. I was treating a patient for malaria who one moment was having a conversation with me, totally lucid and awake, looked pretty well, said, "I'm not feeling so well." 6 hours later, they were in a deep coma from the malaria that had spread to their brain. Most children who die of malaria die within 48 hours of their first symptom. And so reaching children fast saves lives.
Well, looking at what you're doing there, Ari, and I know that you're collaborating with the Malian government and also the various agencies and nonprofit organizations, the NGOs within these local communities. How do you see this collaboration with the government and other NGOs to be critically important to the outreach of what you're doing through Project Muso itself?
So we partner very closely with the structures of the Malian Ministry of Health and with local communities, because from our perspective, they're the ones leading the charge in the long term. So every step of the way, we're working to build that local capacity, build their ability to take the lead, both because they know best what their own communities need and because we should be investing in them as leaders of that change in the long term. That's the most sustainable and durable solution that we can look for, engaging as partners and empowering and training leaders.
Well, looking at these women here, I think these are actually some of the parents, but also some of the local healthcare workers that are going into the community. And many of these people have, at best, maybe primary and secondary education, and yet they're being empowered to go out and become, healthcare workers within their own local community. So what do you see as a sustainable model here, Ari, that you can share in about 60 seconds as we look around the globe to replicate this project that you've evolved in Mali and Western Africa?
It's incredible. We are seeing these community health workers, some of whom who had never had a chance even to pick up a pen before they started working with us. And now they are doing rapid antigen diagnostic testing, a finger prick blood test to diagnose malaria in the home. They're filling out forms on cell phones and transmitting patient data in real time. There's incredible untapped talent in these communities that haven't had as much access to education opportunities that we take for granted here in the United States. So we're seeing that power, that dynamism and brilliance unleashed. It's really exciting. And I think there's a lot of potential to scale this here, to scale these lessons, to really enable communities to reach out and claim their right to health.
Well, R.A.D. Johnson, MD, is Co-Executive Director of Project Muso in Mali, West Africa. Right beside me is Nelly Pavisich, who is the International Service Committee Co-Chair. And Nelly, thank you for bringing all these people together and letting us work together in this effort. And thank you for being with us on the Emerald Planet as we bring you the best of the best practices from around the globe as we create the Emerald Planet.